Hi friends, once again welcome back to my channel Mukambika Nursing. Friends, here we are discussing important questions and answers for RRB Nursing Officer exam preparation. Also, these questions will helpful for your other nursing officer exam preparation. Let's see the question one by one. First question, a child with cystic fibrosis is receiving gentamicin. Which nursing action is most important? Options. Option A, monitoring intake and output. Option B, obtaining daily weights. Option C, monitoring the client for indications of constipation. Option D, obtaining stool samples to test for occult belt. Here the question is, a child with cystic fibrosis is getting gentamicin. Gentamicin is an example of aminoglycosides. Okay, among this option, which is the most important nursing action for this child? Here, cystic fibrosis is a multi-system autosomal recessive trait disorder. Okay, so and the correct answer for this question is option A, monitoring intake and output. Monitoring intake and output is the most important nursing action when administering an aminoglycosides, for example gentamicin, because a decrease in output is an early sign of renal damage. The adverse effect of aminoglycosides include ototoxicity, renal toxicity, gastrointestinal irritation, palpitations, blood pressure changes, hypersensitivity reaction, confusion, disorientation. Move on to the next question. The nurse assesses the result of a gentamicin through blood level for an adolescent with cystic fibrosis who has had been treated with gentamicin several times over the last year. The drug level is high. What is the nurse's primary concern? Options. The child may develop liver dysfunction. Option B. The child may suffer hearing loss. Option C. The medication may have been administered incorrectly. Option D. The child may need to have a different antibiotic. Here the question is, an adolescent child with cystic fibrosis is taken gentamicin for several times for last 1 year. So the nurse is assessing the drug level, that is gentamicin level in the blood, and the drug level is high. So for this client, if the drug level is high, what can occur for the child? For that, what the nurse's priority concern? And the correct answer is option B, the child may suffer hearing loss. As we already discussed in the previous question, the main adverse effect of aminoglycosides is ototoxicity. And the other system-wise side effect will occur, that renal toxicity, gastrointestinal irritation, blood pressure changes, hypersensitivity reaction, all will come. But the main side effect is ototoxicity, that it will affect the functions of the ear. So the child may suffer from hearing loss. Move on to the next question. When developing the plan of care for a child with cystic fibrosis who is scheduled to receive postural drainage, the nurse should anticipate performing postural drainage at which time? Options. Option A, after meals. Option B, before meals. Option C, after rest period. Option D, before inhalation treatments. The question is, a child with cystic fibrosis is planned for postural drainage. Which is the best time to do postural drainage for the child? And the correct answer is option B, before meals. This postural drainage procedure helps to mobilize most thick secretions present in the chest. If you are doing this procedure before meals, means we can avoid the possibility of vomiting, then regurgitation of food and all. So we have to do the procedure before meals. Move on to the next question. Genital herpes simplex increases the risk of dash cancer. Options. Option A, ovaries. Option B, cervix. Option C, uterus. Option D, vagina. Genital herpes simplex or herpes simplex viruses increases the risk of cervical cancer. Option B is the correct answer, cervix. Move on to the next question. The vaccine used for the prevention of cervical cancer is? Options. Option A, BCG. Option B, IgG. Option C, hepatitis B. And option D, HPV. The vaccine used for the prevention of cervical cancer is HPV vaccine. Option D is the correct answer. Move on to the next question. Immune reaction occurring in a blood transfusion reaction is a type of options. Option A, microangiopathic reaction. Option B, autoimmune reaction. Option C, macroangiopathic reaction. Option D, isoimmune reaction. The question is the immune reaction. Immune reaction means the body itself fighting against foreign substances. So the immune reactions occurs in blood transfusion is a type of isoimmune reaction. Option D is the correct answer. Move on to the next question. Which microorganism associated with cervical cancer? Options. Option A, cytomegalovirus. Option B, pneumocystis carinii. Option C, HPV. Option D, Mycobacterium avium. The organism which is responsible for cervical cancer is HPV virus, human papilloma virus. Option C is the correct answer. On to the next question. Danazol is used in the treatment of options. Option A, cyclical mastalgia. Option B, breast cyst. Option C, non-cyclical mastalgia. Option D, epithelial changes in breast. Danazol is an example of 17-alpha ethinyl testosterone derivative. Okay, it is used for the treatment of cyclical mastalgia. Option A is the correct answer. We can see the uses of danazol. This danazol is used both in male and female. In females, it is used in case of uterus related problem, that is endometriosis, in case of DUB and fibromyalgia. Okay, that and all we can treat by using danazol, and also in breast related problem like cyclical mastalgia and fibrocystic breast disease. Okay, here in our option cyclical mastalgia is there, so this danazol is used to treat cyclical mastalgia. In case of male, it is used to treat in precocious puberty, gynecomastia and improve libido. Okay, so this danazol is used in both male and female. And the next question, drug of choice for post-pill amenorrhea is? Options. Option A, mifepristone. Option B, danazol. Option C, clomiphene. Option D, progesterone. Question is, which is the drug of choice for post-pill amenorrhea? It is clomiphene. Option C is the correct answer. Post-pill amenorrhea means when the woman is not getting her periods within 3 to 6 months after stopping birth control pills. Move on to the next question. GnRH analog may be given in all of the following except. Options. Option A, prostate cancer. Option B, endometrial cancer. Option C, fibromyalgia uterus. Option D, precocious puberty. GnRH means gonadotropin releasing hormone. So this gonadotropin releasing hormone can give in all the cases except is the question. So and the correct answer is option B, endometrial cancer. Gonadotropin releasing hormone is used for the treatment of adenomyosis, cancer of breast, dysfunctional uterine bleeding, endometriosis, fibromyalgia uterus, infertility, hysterism and precocious puberty. Here it is used for the treatment of endometriosis, not endometrial cancer. So our correct answer is option B. Move on to the next question. Accumulation of hydrophilic mucopolysaccharides in the dermis and other tissue is seen in? Options. Option A, scleroderma. Option B, systemic lupus. Option C, erythematous. Option D, elephantiasis. Option D, myxedema. Hydrophilic mucopolysaccharide, that is water related mucopolysaccharide accumulation is in the dermis and other tissue is seen in case of myxedema. Option D is the correct answer. We are discussing important questions and answers. Surely these questions and answers will helpful for your coming exam preparation. If it is useful for your studies, please share my videos to your friend circle.